Good morning. We'd like to welcome all of you to our virtual press conference to discuss the proposed rule published today, which, if finalized, would make cigarettes and certain other combusted tobacco products minimally or non-addictive by limiting the level of nicotine in those products. First, we'll hear from FDA Commissioner Dr. Robert Califf, and then from Dr. Brian King, Director of the FDA's Center for Tobacco Products. Following their remarks, we will allow time for questions from the media. With that, I'll turn it over to Dr. Califf.
Good morning, and thanks to all of you for joining. As my days as FDA Commissioner are coming to a close, I feel privileged to be able to join you today to discuss this very important proposed rule, as it's closely related to a topic that's very important to me, and that's reducing premature death and disease. Smoking-related disease kills nearly 500,000 people every year in the U.S., and combustible tobacco is the leading cause of preventable disease and death in our country. We cannot accept this as the status quo, especially as the life expectancy in the U.S. lags behind many other countries. In addition to the toll on lives, there's a tremendous amount of chronic disease and disability caused by combustible tobacco. If you've ever cared for a person with chronic lung disease or trying to cope with a stroke, you never forget it. Smoking also costs the country $600 billion annually in healthcare costs and lost productivity. Today, we're taking a significant step to address this by proposing a rule to reduce nicotine to a minimally or non-addictive level in cigarettes and certain other combusted tobacco products. Multiple administrations have acknowledged the immense opportunity that a proposal of this kind offers. This proposal envisions a future where it would be less likely for young people to use cigarettes, and more individuals who currently smoke could quit or switch to less harmful products. This action, if finalized, could save many lives and dramatically reduce the burden of severe illness and disability. Based on the FDA's population health model, by the year 2100, this nicotine product standard could prevent approximately 48 million U.S. youth and young adults from starting smoking, and it could save more than 4.3 million lives. Due to the lives saved and diseases averted, the estimated benefits of the proposed rule are more than $1.1 trillion per year over the first 4 decades. I hope we can all agree that significantly reducing the leading cause of preventable death and disease in the U.S. is an admirable goal that we should all work toward. The FDA also recognizes the importance of ensuring broad and equitable access to all the tools and resources that can help smokers quit. With that goal in mind, the FDA and the Department of Health and Human Services are working with federal partners to maximize support for those who are trying to quit, especially in underserved communities. This is a key focus of the Office of the Assistant Secretary for Health's framework to support and accelerate smoking cessation. Most insurance plans cover tobacco cessation services like medication and counseling without any out-of-pocket cost. Additionally, the federal government has multiple free resources, including smokefree.gov and the National Quit Line, 1-800-QUIT-NOW, to facilitate smoking cessation among persons who smoke and to share cessation services available within each state. Today's proposal, if finalized, will save lives, and the FDA will continue to do everything within our regulatory authority to reduce preventable disease, death, and disability from smoking. I'll now turn it over to Dr. King to provide more details on the proposed nicotine product standard.
Thank you, Dr. Califf. Good morning, everyone. Pleasure to join you all today. As a scientist myself, I'd like to start by discussing the science behind today's announcement. Now, as you all know, the focus of this rule is nicotine, and nicotine is the primary addictive chemical in tobacco products that keep people using them, even if they want to or they've tried to quit. And in the case of combusted tobacco products, that is those that are smoked, nicotine addiction leads to users being repeatedly exposed to a toxic mix of chemicals that cause numerous adverse health effects, including cancer, heart disease, and others. And many of these diseases are fatal. That said, based on the comprehensive review of the scientific evidence, as well as information previously collected by the agency through public comments, today FDA is proposing to cap the nicotine level in cigarettes and certain other combusted tobacco products at 0.7 milligrams per gram of tobacco. This level is significantly lower than the average concentration in these products on the market today, about 95%. And by reducing the nicotine level of cigarettes and certain other combusted tobacco products to a level low enough to no longer create or sustain addiction, that cycle of exposure to these toxic chemicals can be broken. And that's expected to greatly reduce smoking-related disease and death. Now, Dr. Califf has already noted some of the longer-term projections of the impact of this rule, but I also want to highlight that the model projects that more than 12.9 million Americans who smoke cigarettes would stop doing so 1 year after this rule would become effective. That would include those who would quit smoking altogether, but also those who would completely switch to lower risk alternative tobacco products. And after 5 years, it's estimated that a total of 19.5 million Americans would quit smoking cigarettes. Now, I want to be clear here. The proposed rule would not ban cigarettes or other combusted tobacco products. It would, however, limit the nicotine in these products to a level low enough to no longer create or sustain addiction. Now, there's multiple pathways by which these benefits could be achieved. For example, in addition to preventing initiation among young people and promoting cessation among people of all ages, the FDA expects that the proposal would also help adults who smoke switch to lower risk alternatives. And so for adults who smoke, switching completely to a lower risk tobacco product, such as FDA authorized e-cigarettes, would reduce exposure to the many harmful chemicals present in cigarettes and other combusted tobacco products. But it's important to note that no tobacco product is safe. And so you should not be using any tobacco products, and adults who do not currently use them should not start. Now, before closing, I want to briefly touch on the history leading up to today's actions, as well as what the next steps are. Now, as you know, today's action is a critical step in the rulemaking process, which provides the public with a proposal for review and engagement. And it's a step that's been built upon past work by the agency over many years. For example, the FDA first announced its intent to propose such a rule in 2018, when we issued an advance notice of proposed rulemaking. And at that time, we requested public comment on such an action. So today's announcement is the next step in that rulemaking process, building upon the feedback received during that public comment period. But I want to reinforce that the opportunity for public comment doesn't end there. The proposal we're announcing today allows for an important and transparent conversation about how we meaningfully tackle what is one of the deadliest consumer products in history. So with that goal in mind, the agency is committed to providing multiple opportunities for public engagement on that proposal, and that includes referring it to the agency's Tobacco Product Scientific Advisory Committee for a public meeting. Now, in closing, I want to reinforce the public health importance of this proposal. We have made considerable progress in reducing smoking in the United States, which I would personally consider one of the greatest public health accomplishments of the past century. But smoking is still the leading cause of preventable disease and death, and tens of millions of Americans are still using these products. That said, today's action is a pivotal step towards reducing these monumental adverse health effects and the more than $1 billion spent per day in this country on smoking-related healthcare costs and lost productivity. With that, thank you, and we'll now turn the press conference back over to the moderator for questions.
Thank you, Dr. Califf and Dr. King. We'll now move to the question and answer portion of the call. As a reminder, if you have a question, please raise your hand now via the participant panel. When you're selected, please unmute your mic and turn on your camera. The first question comes from Alex Tin. Please remember to turn your camera on and unmute your mic.
Hi, can you hear me? Hi, thanks for taking my question. I actually wanted to ask two questions. First, we spoke with Mitch Zeller. He told us that he outlined a plan in 2022 to get this done by 2024. So why is this late? Why didn't you get it done by 2024? And then second, why do you think we won't see a market of imported black market cigarettes that are above the nicotine level? Thanks.
Yeah, thanks for the questions, Alex. So I'll start with the first one. In terms of today's action, this is the continuation of a long-standing effort to collect the necessary information to inform the development of this rule and the rulemaking process. That said, this is not the first step. We've had several engagements going back to 2017 when this was first announced, but following that, we had various opportunities for public comment to inform where we are today, and that included in 2018, an advanced notice of proposed rulemaking where we got 7,000 comments from the public, and we all used that to get to this point, which is a proposed rule. And so that takes time to collect the information, to review the science, and what we're doing today is continuing that rulemaking process to allow for further opportunity of a specific proposal, including input from a variety of stakeholders, including on a variety of issues, including the one that you note, which is illicit trade. That said, as part of that initial advance notice of proposed rulemaking, we also issued a study and solicited a comment on the issue of illicit trade with regard to product regulation, and that was considered as part of this proposed rule. And so that said, this latest proposal is still going to have opportunity for public comment, including on illicit trade, but ultimately we believe that the extent of illicit trade will not be greater than the level of the benefits that we're seeing. And that's for a variety of reasons. One, we're not proposing to ban any category of tobacco products. And so the product standard is not expected to lead to significant illicit trade. But we're also having a nationwide standard, which would affect all states. We're also going to be taking enforcement actions and other steps. And importantly, there's also going to be other products that are going to be available on the market, including lower risk alternatives that will still be available for people. But ultimately, we're not banning cigarettes. We're just modifying the ingredient in those products that make them highly addictive. And so even if some amount of illicit trade develops, we still have significantly greater magnitude of benefits that would outweigh any impact from potential illicit markets.
Alex, I'll just chime in. I really I think we really do appreciate the question. Brian is giving, I think, a very good answer. I'm about to finish my term, so I'll just say a little bit more. I think everyone on this call is aware of the fact that we will be sued on anything that comes into action. And that means we really have to cover these comments that Brian referred to, and the research has to be airtight to survive the challenges that we know we'll get in court. Keep in mind, this is an industry that's still fighting us tooth and nail on graphic warnings on cigarette packages. Hard to imagine we're the only remaining high-income country that doesn't have graphic warnings on cigarette packages. And so we have to have everything just right in order to succeed.
Thank you. Our next question is going to be from Lauren Gardner at Politico. Please remember to turn your camera on and unmute your microphone.
There we go. I think I'm there. Okay. To follow on Alex's question, I just wanted to kind of put a finer point on it. Given all of the additional comment and study and advisory committee meeting and these other steps that you anticipate being taken before this ever becomes a final rule, do you want this rule to be finalized by the next administration? Is that what you're expecting here, that within the next 4 years, this would become a final rule issued by the FDA?
So I'm not going to prejudge the process before it's allowed to play out. And so right now we're at the proposed rule phase. And as part of that rulemaking process, this is where we collect the information from the public and have an important dialogue. And based on that information, we then make a decision about where we go forward. And that could be finalizing the rule. That could be collecting more information. That could also be not proceeding forward. But what I don't want to do at this point is prejudge the information and dialogue before we have it. And so obviously we know this would be one of the single greatest and impactful practical strategies that could be implemented to reduce tobacco-related disease and death that this country has ever seen. And so we have the science to back it up, but ultimately we have to have that important dialogue, and that takes time, as the commissioner noted. And so for our part today, we're committed to initiating that dialogue and allowing the information to be shared for a transparent conversation.
Like with the last question, Brian has given the correct answer for a civil servant. And I think that literally is the correct answer. But as a political appointee, I'll just say, and keep in mind, you're looking at someone here who spent a career caring for people in intensive care units, the majority of whom in adult intensive care units have been affected by combustible tobacco. And I also had the privilege of attending Sir Richard Dahl's retirement party in Oxford, the gentleman who studied the British doctors that really nailed this issue, where British doctors who smoked lived 10 years shorter than British doctors who did not smoke. And it's been a long journey to get here. So if you look at the magnitude of this, over $1 trillion per year, if you only care about the money, but look at the death and disability that could be prevented. So yes, if there's a goal to make America healthy again, I can't imagine anything more important to get done than this.
Our next question is going to be from Nick Florco at The Atlantic. Please remember to turn your camera on and unmute your microphone.
Hi there. Thanks for doing this. I was curious if you all had some sense, either through research that's been conducted or even just your own thoughts on sort of how consumers might respond to these products. Because, of course, we know nicotine is the addictive product in cigarettes, but it's also sort of what derives, some level of pleasure from nicotine. It's sort of why people enjoy smoking cigarettes when they smoke cigarettes. And I guess my question is, would something like this essentially put cigarettes out of business without banning them? How do you think about just what the market would be for something like a very low nicotine cigarette?
Yeah, so appreciate the question. Ultimately, in the modeling studies that we conducted, we looked at various scenarios, and it's based on the literature, including clinical studies, randomized trials, to see what people do in these environments when exposed to very low nicotine-containing cigarettes. And so some of the key factors that have been looked for in this research is compensatory smoking. So if you lower the nicotine, do people just smoke more? But also, what is the impact in terms of withdrawal symptoms and other factors? And so what we know based on that literature, which is summarized in the rule, is that an immediate reduction approach is most impactful. And so when we do an immediate reduction in the nicotine levels, you're going to see very little compensatory smoking, and it's ultimately going to be self-limiting and fairly short term. And again, this is based on the trials. And so ultimately at the broader level, that's what we would expect here. And that's why in the proposal, we're proposing for an immediate reduction so that you would see that benefit. Ultimately, in terms of what happens when you reduce the level in cigarettes, people can do a lot of things. One is to reduce to lower nicotine cigarettes. And so we anticipate that will happen. We also anticipate that many people will quit, estimated about 13 million within the first year. But we also anticipate that people will transition to lower risk alternative products as well. And so you'll see in this proposal, we're only focusing on combusted products, including cigarettes and certain other combusted. But there is a likelihood that people will transition to other products. In the model, we anticipate it's about 50% of smokers would transition to these other products, whether that be, e-cigarettes or other non-combustibles. And so ultimately a variety of pathways by which you get the benefit. But bottom line is we follow the science here, and that shows that immediate reduction has the greatest impact. It diminishes the extent of compensatory smoking. It also diminishes the extent of withdrawal. And that's what gets us to that public health impact and benefit that's provided in the models.
Nick, I would just add your depiction of nicotine as pleasurable. That's a complicated issue, right? And I hope there'll continue to be research in the new environment, assuming this rule is finalized, which, as Brian has noted, it's not appropriate for Brian or others in the CTP to prejudge the outcome. But assuming that, the question of when the so-called pleasure is just satiating the receptors that are screaming out from nicotine addiction, or whether it's an innate property of nicotine that it's behaviorally beneficial. That's a question about which there are different views in the scientific world, but there's a real need for research.
Makes sense. Thank you both.
Thank you all for joining us here today. I don't see any other questions or hands raised, so thank you again for participating in the press conference. We invite you to visit our website at fda.gov for more information about today's announcement. And this concludes today's FDA press conference. A replay will be available on the FDA's YouTube page. And if you have follow-up questions, please don't hesitate to contact the FDA press office at fdaoma@fda.hhs.gov. Thank you and have a great day.